I'm Dr. Michael Faust. I'm a pediatrician at the Washington Health System's Washington Pediatrics office. And like you, the main topic of conversation here has been COVID-19, and more specifically the Delta variant. I'll tell you that the information is always changing. What we currently know is that the Delta variant is a little bit more contagious than the typical COVID-19 variety. It is probably the variant that is fueling the surge that we are experiencing in our area right now. We are occasionally asked if my child has the Delta variant or the regular COVID-19, and that might be a little bit oversimplified, but the fact is right now most of the COVID-19 that we are seeing is more than likely the Delta variant in our community. To put it in perspective, the numbers we are seeing in the United States now, this week, are higher than any week we saw last summer during COVID-19. So this is a legitimate surge we are experiencing and something that we truly need to address. As far as how bad this variant is compared to the standard COVID-19, it seems to be a little bit more infectious. Actually, it seems to be a lot more infectious. It seems to be a little bit more dangerous. Is it more dangerous to your child? COVID-19 certainly seems to affect people over the age of 75 more than it's going to affect people in the pediatric age group. But because of the vast number of children that do get infected, that's a problem in and of itself. If you think about the COVID-19 as something that needs a place to colonize and grow and change, that's the pediatric population. They are where most colds come from. Think about the typical flu season. When we experience flu outbreaks in our community, it's the kids that get sick, but not that sick. They get sick enough that they can spread the germs. They still go to school, they still go to daycare, they spread it to their friends, they go home, they infect the grandparents, and that's where you see the real morbidity and mortality. And that's what we're trying to avoid. Probably the best thing you can do is use common sense. Don't send your kids somewhere if they're sick. Don't send them to an environment where there are sick people. If your child has a runny nose, don't assume everything is okay and send them to daycare anyway. Please keep them home. If your teenager wants to go hang out with his friends, I mean, it's August, the weather is beautiful. Send them outside somewhere to gather, because they're much better off gathering outside than inside. Everybody is acutely aware that last year's school year was not good, that there was so much anxiety, flat out depression in children who are being schooled at home. They need that social environment, they need that better interactive teaching environment. And so everybody, the CDC, the American Academy of Pediatrics, and all the local school districts agree in-person learning is very, very important. Now there's got to be a bit of a trade-off. So the CDC is recommending masking for all unvaccinated people in school. So that means everybody under the age of 12 is going to have to wear a mask. People that are vaccinated over the age of 12, in theory, do not need to wear a mask in school. But the American Academy of Pediatrics differs just a little bit, because I think they recognize that children are going to want to do what their peers do. So if you tell 3 out of 10 kids you don't have to wear a mask, guess what the other 7 are going to do? Well, I don't have to wear a mask then either. So right now, the recommendation from the American Academy of Pediatrics is to have all children wear masks in school. It stinks. I don't even like wearing a mask here in my office, but we do because we have to. The trade-off is what is important. If you wear a mask in school, you can pretty much do everything else you used to do in school. Even the spacing this year is recommended to be 3 feet instead of 6 feet. So you can have your interactive classes, you can have your labs, you can do those things that you used to do. But if you ask me, kids should be wearing masks in school. If it's optional in your school district, I would say advocating for wearing masks might be the right thing to do. Could this change in a month? It could change next week. You know, this is such an evolving process that I understand there's a lot of criticism of, quote, the flip-flopping that you see from the experts. I personally have not seen any flip-flopping. I've seen new data come in and then new decisions being made on the new data. And that's exactly what we're going to do with these masks. I think everybody should start the school year with them and then sort of reassess as we watch the numbers of infections evolve over time. I bet every time you send your kid to school, they're wearing pants. And they're wearing pants not because God told them to wear pants. They're wearing pants not because it came naturally to them. They're wearing pants because you teach them to wear pants. And so you can actually teach a kid to wear a mask, and it's not that hard. Just gentle reminders to put it back on, get a mask that they like. That goes a long way. And most importantly, model that behavior. You know, let them see you wearing a mask. Look, honey, we're gonna go to the Giant Eagle. Let's get a mask and put it on and we'll go to Giant Eagle together. And that, they wanna be like you, they wanna do what you do, they wanna please you. So please use these techniques and you can very comfortably get your toddler, your preschooler to wear a mask just like everybody else is. So children aged 12 to 16 are now approved to get the Pfizer vaccine. That vaccine is available all over the place, including at the Washington Health System and including at many local physicians' offices. So if they are curious about getting it, I think it's a great idea to give it to your child. The most common pushback I get from parents is, I want to wait, I want to make sure that it's safe, I want to give it some time, I'm concerned about long-term side effects. And I agree that these are very legitimate questions. 350 million doses of the COVID vaccine have been given in the United States, and millions have been given in that 12 to 16 year age group. So I think it's very safe to say that safety is not a concern. As far as long-term side effects to a vaccine, you have to remember that a vaccine is simply kind of like an email to your immune system saying, hey, look out for this. And your immune system says, okay, I'll watch out for that. So the information that it leaves behind is actually not unlike the information a natural infection leaves behind. So as far as long-term side effects to a vaccine, you really don't see any that you're not going to see more of from the illness itself. So don't fear the long-term side effect, number one. Number two, it's a pandemic. We kind of want to address this now, not 5 years from now. So I think the safety data is really quite solid, and I personally was very comfortable giving this vaccine to my teenage children. I hope you will be too. It is legitimate. There have been a handful of cases of myocarditis in teens that have gotten the COVID vaccine. But what you need to know to put that in perspective, that makes a huge headline whenever you read it online. But COVID itself will cause myocarditis. And in fact, one of the large NCAA football conferences didn't play football for the first month of last year because they were seeing significant myocarditis, cardiomyopathy in the athletes that were playing football. They were very concerned about their health and safety. That degree of myocarditis seemed to be much more significant than what we're seeing in the vaccine. And that makes perfect sense. You know, most vaccines can cause a little bit of what the disease can cause a lot of. So as far as the safety of the vaccine goes, I think when you look at the number of cases of myocarditis from the vaccine over the number of cases of myocarditis from the disease that can be prevented, it's a pretty easy call that you should go ahead and get the vaccine.